Alright, so what's going on, everybody? My name is Matthew Jordan, and today I will be discussing with you guys today the comparison of healthcare quality, not only in America, but comparing it to a third world country, in this situation, the Philippines. So without further ado, let's get right into it, alright? So the reason why I chose this topic was because of not only my parents, but also because of myself. With my mother being actually both my parents being immigrants coming to the United States in the early 90s, their sole purpose was to, of course, pursue the American dream, as of every other immigrant is. But my mother has been a nurse for the past 35 years, and my father has been a businessman. And my mother did start her practice in her first 7 years in the Philippines. And if you guys don't know where the Philippines is located, it is located in Southeast Asia, around a 3 to 4 hour plane ride from mainland China. So my mother again started her practice in the Philippines for 7 straight years at Medical City Medical Center, located in the capital city of Manila. Now, with me traveling back and forth, and as I got older, there were situations where I did get sick, and where I did have to become hospitalized. Not major issues, but for example, like a stomach virus or a fever or some minor issues, for example, of those natures. But when I came across on how they did those, how they practice, it really astonished me of how different it was compared to the United States of America. So today, I will be discussing with you guys not only the differences between the comparison of health quality in America versus the United States, but I will also want to address the quality issues that we have in our country today, possible solutions, how we could solve it, and yeah, as you can see right there. So, bringing to Exhibit 1, with the CommonwealthFund.org, in the year 2014, they have compared 11 first world countries in the United States, with the United States ranked last for the overall ranking. When it came down to quality, however, comparing it to the other 10 countries, the U.S. fares best on provision, recipient of care, of preventive and patient-centered care. It has been explained that there has been improvement with the quality of care in recent years, but the lower scores were on the safe and coordinated care. Now, the reason for this, I believe, is due to the lack of HIT. With the lack of HIT is actually hindering our overall quality, in which its advancement in the oncoming years should allow many more endless possibilities and increase abilities of U.S. physicians to identify, monitor, and coordinate care for their patients, particularly those with chronic conditions. Coming to the second point, from healthsystemtracker.com, I actually found this where it actually summarized multiple factors of what needs to be measured in order to deliver and achieve quality healthcare towards our population in America. The first idea which was looked at was short-term outcomes following treatment and diagnosis. The writer described one metric which relates short-term outcomes to health system performance, which is mortality, within 30 days of a hospital admission. Progress toward treatment and quality care delivery has improved with a reduction of deaths after receiving short-term care through a 30-day mortality for heart attack, stroke, and pneumonia. The second idea which was then presented was process measures, also known as right care, right time. Quality is looked at through monitoring the activities of clinicians and institutions, which are believed to lead to better outcomes. Assuring there has been an improvement from the years of 2005 to 2012, a metric has been performed by the Agency for Healthcare Quality Research of how often patients do receive recommended care across a range of services. From this measure, there has been a 4% increase for their section of patients receiving recommended care from 66% in 2005 to 70% in 2010. With a 4% increase, this identifies more physicians and clinicians are following the book to deliver proper treatments, processes, or action. The way hospitals, physicians, and clinicians can improve health outcomes is to improve screening and preventive care, whether it may be through educating the population about certain diseases, identifying diseases adults and children may have, and providing vaccinations for young children. Now, the third topic which was then brought up, which I personally thought was great, was patient safety. Now, I found this through the BeckersHospitalReview.com, and they did a study in the year 2017, which is this year, where the top 3 patient safety issues in the United States are health equity, sterilization and processing issues, and patient care transitions. The Institute for Healthcare Improvement defined health equity as an opportunity to attain their full health potential. When access to health is not equitable, it can lead to poor health outcomes for patients. Social determinants does play a big role in health outcomes. However, healthcare organizations plays a big part for improving health equity in communities. Creating methods and making resources available in decreasing institutional racism, along with developing partnerships with fellow community organizations. With sterilization and reprocessing issues, that is a very big safety concern for my mother and also for me as well. My mother has actually explained to me how she has seen throughout her 35 years of practice, she has seen nurses, aides, or any of those types of individuals actually take shortcuts and not following proper protocol, which is a very, very big issue in our country, I believe. Studies showed that hospitals have encountered troubles with cleaning and sterilizing equipment in 2016, with it being close to impossible to remove all contamination from robotic surgical instruments, stated by the Infection Control and Hospital Epidemiology. The best way to deal with this issue is to retrain staff with new sterilization methods to ensure no infections and disease will spread. Finally, with patient care transition. Patient care transition is another problem my mother always addressed with me whenever they get a new admission from another facility. It was found by a study conducted by the Journal of the American Medical Association. The end of rotation between resident care teams was associated with a significantly higher risk for inpatient mortality. This can be easily modified by checklists and patient handoff tools. According to the Journal of the Human Factors and Ergonomic Society, in November of 2016, they have stated they have found good evidence for the general benefit of using handoff protocols regardless of setting or protocol type. So when it comes down to healthcare quality in the Philippines, for me it is actually described by one term, and that is cheap. Speaking through experience and speaking through actually my family as well, if you do have money, you will be treated immediately. There is no questions asked. They will give you the medicine, they will diagnose you immediately. I mean, if you want to get a second opinion, you can, but you will be out of there in no time. And that is the problem that I believe that is the issue that is going around. An example of this is actually back in the 80s, when my mother still worked in the Philippines in the late 80s. The majority of my mother's patients were actually Japanese, and the reason why the Japanese would go there was because the healthcare was, of course, cheap. And at that point in time, kidney transplants, for some reason my mother told me, was a very, very big issue in Southeast Asia or in Asia as a whole. And a bunch of her, the majority of her patients were, again, Japanese. And the amount that they would be spending compared to, in the Philippines compared to their country is a very large gap. And when it comes down to individuals who are on the level of poverty and are on the poverty level, they simply cannot afford healthcare in the Philippines, which is a big issue. In the recent years, they actually did pass something called PhilHealth. And as you can see on the screen, PhilHealth, your partner in health. That is their motto right there. But me personally, that is a complete lie. It was described as a health insurance company, but it was more government-based, where it was something similar to the Affordable Care Act, where they wanted to provide and create a mandate that every single individual in the Philippines would receive health insurance. Now, that is a complete lie, because corruption and reform is still a big issue in that country. We do get $20 million is the budget, US dollars is the budget in the Philippines for healthcare. But I want to say at least half of that is not even going towards the system, which is a very, 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 very complete lie. The problem is with the PhilHealth organization is that even though that it is trying to cater towards the individuals with poverty, it is still about people with wealth or the middle class families, because the premiums are still too high for the average worker who is earning around even less than $5 a day, and 27% of the population is still in poverty. And if they cannot afford to support their families, they cannot afford to support their families, and they cannot afford to support themselves, how can they possibly get health insurance or health coverage of that nature and try to afford for it? Unemployment does not exist because, again, the government is still in a stage of corruption, and it's easing its way out of it, though. But going off of quality of care, healthcare in the Philippines, it's a good standard compared to here in the United States. Of course, the major hospitals are going to be the main big honchos over there, but I want to say a comparison of the hospitals such as Medical City or St. Luke's of the Philippines is a good equivalent to Lehigh Valley Health Network or St. Luke's here in Bethlehem. Many of the doctors and nurses are trained out of actually either in the country through the top medical systems there or medical schools, and some of them are actually trained here in the United States or actually in Europe, which is a good benefit. Now, coming to a conclusion, the overall quality of care in the United States and in the Philippines is not at all that bad for the areas that they are in. However, we all can see that there is room for improvement. Improvements with methods as simple as retraining staff, following protocols and procedures, educating individuals about illnesses, and increasing patient interaction. Simple methods such as these can increase quality care in our country to avoid any more complications.